breakdown of PLAB 2. I'm going to tell you the things that used to confuse me when I used to prep for PLAB 2. Starting off with FY1, FY2. What are these two? What's different? FY1, FY2 are pretty much interns, okay? Imagine you just graduated med school and you started your internship. Globally, I think internship is done 1 year. In UK, it's done 2 years. It's FY1, FY2. FY1, you have limitations. You can't do everything you want. FY2, on the other hand, you can do everything you want. You've been in this job, you've been in this system, you know what to do, you know how to get things done. With that being said, what does it mean when they tell you you're an FY2 working in ANE? You're an FY2 working in EAU. You're an FY2 working in surgery. You're an FY2 working in psychiatry. So this is what you need to do. Once you read the script, be careful because you're an FY2 working where and you've been called to see a patient where. Sometimes you're an FY2 who's working in medics, for example, EAU. You're called to see a patient ANE. So what you need to understand is that in UK, ANE is a totally separate and individual specialty. ANE does not admit patient under ANE. ANE is an emergency unit. The patient comes through ANE. ANE doctors assess. They want to make sure that the patient, they want to do their assessment as quick as possible. There's no acute risk. After that, they find this patient, the diagnosis they have in mind. Where would it fit better? Does this patient needs to go under medics? Does this patient needs to go under surgical team? Does this patient needs to go under psychiatry? And hence they liaise with which one needs to admit the patient, or they can discharge the patient. Now, another question is, what is medics? This is very confusing for some people. Medics are pretty much IMTs, internal medicine, like cardiology, respiratory, gastroenterology, endocrinology, you get the point. Surgical, you know, and psychiatry, you know. Moving on, if you work in medics, let me give you an example. You're an FY2 who works in EAU, for example. You got called to see a patient in ANE who overdosed on paracetamol and now the patient wants to be discharged. It's not your job to assess mental health for this patient, to assess this patient's psychology. Because you're an FY2 who works in the EAU, Emergency Assessment Unit. Emergency Assessment Unit, I'll explain it in the next video. Watch it and let me tell you how it would go, the assessment for this patient who overdosed on paracetamol in my next video.